Hello everyone, am I audible to all? Uh, I request all of you to just use one of our WhatsApp group, which is the Inner Circle group, which you all are the privileged members of, and just let me know. Please give me a- So I'm going to constantly check my messages on the Inner Circle group. So if I'm audible, please let me know I'm audible. Yeah, thank you. Thank you. So I see a lot of new people today. First of all, let me wish you all a great new year, a great beginning for all of you. And I wish that the upcoming year brings all of you a lot of prosperity, good health, and success. I request all of you to just use the Inner Circle WhatsApp group. And I see a lot of new names and numbers today. So just let me know those of you who are attending this webinar for the first time. Please just identify yourself, please. Anyone in this group who is attending this kind of webinars for the first time, the Inner Circle meeting for the first time. Those of you who are using the Facebook, I have already put up the Inner Circle WhatsApp link. Savita is there. She's putting up the Inner Circle WhatsApp link. Those of you who are watching this through the Facebook, I request you to join the Inner Circle WhatsApp group. That's where the discussions will happen. And if possible, I request, if not everyone, at least some of you to keep their video on, because I really don't like otherwise, just speaking to a computer screen. So just by seeing the people around makes me more livelier, makes me more interactive. So wherever it is possible, I request you to put on your video also. Yeah, thank you, Dr. Amol. Thank you. Hi, nice to see you. And I see a lot of my known people also. Dr. Ankur is there, Dr. Chetan Media is there, Sarita is there, Dr. Saurabh Jaiswal, Dr. Gaurav, right, Dr. Sumit Kaur. Hello, Dr. Gaurav. Yeah, hi, Dr. Aniket. Hi. If possible, I request, if possible, just put up your names so that I can identify you better, Dr. Vikram Singh Deshmukh, Dr. Saurabh. Yes, nice. So let us just take a couple of, like, maybe another 1 minute or so before we begin our amazing discussion on practice building and revenue generation. Any one of you who is attending this Inner Circle lecture for the first time? Now, before we begin, I just want to unmute, if possible, Dr. Gaurav. Dr. Gaurav Bandil, please unmute yourself. And I want to know that, what are the pain points in your practice? I mean, what is the thing which you feel, if you get your practice will get a boost up? Dr. Gaurav, am I audible to you?
Hello, sir. Hi, sir.
Dr. Gaurav, am I audible? Dr. Gaurav,
Yes, sir. Yes, sir. Yes, sir.
I think, doctor, there is some sound issue. If there's any other doctor, yeah. Aniket, hi, this is your first lecture. Where are you from, Aniket?
Hello.
I think there is some audio issue. No, but Dr. Aniket, I am not able to hear you. Dr. Chetan, Dr. Amol. Dr. Amol, just unmute yourself if you don't mind. Let us make you get up from your Diwali mode into action mode. And Dr. Amol, please share with us what is that one point or one thing you feel if you will get the jump start or a boost in your practice.
So I didn't get you, sir. Can you repeat? Hello.
Yeah, just 1 minute, doctor. Just hold on 1 second. Yeah, yeah, Dr. Amol, please continue with your answer.
Yes, sir, I didn't get you. So I want you ask again what you asked. I didn't get it.
Yeah, sorry, please come again.
So I didn't get you. What have you asked? So can you please repeat?
Yeah, what I was saying is what is that one thing you feel is holding your practice back, and you feel that if this problem is solved, then you will get a big revenue boost in your practice.
According to me, right now I'm just looking for intraoral scanner.
Intraoral.
So because this is a thing which is not having in many of the dentists. So I can tell someone that this is a newer thing which is I am only having and I have brought in my city or in my location. So I can build my practice on that way. Again, it is very simpler to use and all other things. I think you will be focusing on.
Correct. So basically, you are looking at investing in a new technology, and you're planning to use that as your USP, unique selling point, to
Yes, sir.
probably attract more clients. Am I correct?
Yes, sir.
Perfect. Amazing. So let me, I totally agree. It's a nice strategy, but let me share my viewpoints on how you can, probably rocket your practice further. And maybe there are a lot of other things you need to consider beyond just investing in equipments and instruments. So let me just pull up my presentation from here and take it ahead. So I hope my presentation is visible to all of you now. Yes, Dr. Ankur, marketing promotion, yes, very much. So let us come to some conclusions today, and let us see how you can channelize all these collective ideas more better and take these things ahead where we have a specific plan. Because right now what is happening is we have ideas, but we don't have a specific plan. And the my thought process right now is to have a complete structured layout of us knowing exactly what to do, because all of you will agree that unless your mind and body are fine tuned, which means they are in sync, you won't be able to get through. So unless we have a plan, we have something in our mind, only then we can channelize our energy to get it. With that, I present the roadmap, which according to me followed even partially will definitely give you a big boost in your practice. So I hope all of you are charged on with this. And
Progress.
so then, how many of you agree? And let us, when we are discussing these points, let us all be honest with each other. Let us try to be interactive, because it is not just about me giving points. You have put up your holiday evening to be here for a reason. So let us channelize all the energy, all the power to generate ideas which will, immediately we can implement them and we can get benefits out of it. Otherwise, there's no purpose. So this presentation, I strongly recommend for those doctors who are just looking out for some pastime on today's holiday. I don't think you should be around over here. Those doctors who feel what they're doing is perfect, I don't think they should be around over here. Those doctors who are not ready for any change, I don't think you should be around here. The only people who should be attending right now and putting your precious time are those who can be interactive and those who are open to new ideas, and also not only listening to new ideas, probably even suggesting new ideas. That is how collectively as a community all of us can grow. So I want all of you with this to let me know on our inner circle WhatsApp group. This is the WhatsApp group I'm looking at. How many of you feel that if a patient treatment goes wrong, the doctor, that means we are responsible for it, which means that you recommended a treatment to the patient and then something did not come out fruitfully, then somewhere morally, ethically, we are also involved, we are wrong. How many of you agree to this statement? You can type a yes if you agree. If you disagree, you can type a no in the WhatsApp group. I request all of you not to put comments in the chat box. Please use only the WhatsApp group because it will be easier for me to communicate. So if you agree, yes. So Dr. Ankur is saying yes, Dr. Rajat Prakash, Dr. Aniket, Dr. Sumit. Thank you, Dr. Swapan. So almost I think every one of us agrees. Now my next thought process, my next question to you all is that with this same thought process, if, and think about this and answer very honestly, if your practice revenue is not growing or improving, when I say improving, I mean an increase of revenue, increase of more free time for you to focus on your health, your family, your habits, whatever you want to do, and freedom from long working hours. I mean, you're working at your will and you're free at your will. If your practice is not going in that direction, who is responsible for that? Just like we are morally responsible for our patients, who is responsible technically if this thing is not happening in your practice? Let's be very honest. Let's be very blunt with each other. Only then we'll come out with something fruitful. I'm waiting for the answers on the WhatsApp group. If you feel your practice is not growing today, is not growing since the past few months, is not growing since the past few years, who is responsible? Is it the government? Is it that you don't have good staff? Is it that you don't have good infrastructure? Is it that you don't have good equipment? Is it that you don't have good patient flow? What, according to you, is the main problem? Perfect. I'm very glad that a lot of people have commented what I also feel, that if my practice is not growing, if I am not growing, things are going wrong. It is me, myself, who is responsible. Everything else is secondary. So I think Dr. Swapan, Dr. Sopna, Dr. Sheikh, Dr. Aniket, Dr. Sumit, and probably all others sitting here agree on the fact that anything else, for example, if I don't have a good team, I am responsible for creating a good team. If I don't have a particular equipment, I am responsible for generating funds to procure that equipment. If I don't have a particular skill, I am responsible. If I don't have patience, I am responsible. The moment this clicks into us, 50% of your problem is solved, because since the problem is you, the good news is that the solution is also you, which means that the moment you've identified that this is the problem, lot of things have already got solved, because then the only person who can solve this problem is you, since the problem is also you. How many of you agree to what I have mentioned so far? If you agree, so you can put up the comment box a thumbs up. If not, you can let me disagree also. I'm absolutely open. This is like an open session and we are here to interact and grow. And in the next half an hour, 45 minutes, I will show you the exact detailed roadmap of what you should be planning out your subsequent year to be, which will really rocket your practice, just like it has done for so many of us. So with this thought process, would you all agree that there is a problem in our practice? Why else would we need such a lecture? Be open to new ideas and changes. If I do the same thing what I was doing since the past few years, do you think the results are going to really change? Absolutely, it's not going to change. So let's be open to new ideas. Let us not be afraid or scared. I have seen a lot of people, they know something is right. They have been sitting on the edge for years to come and they're still sitting there, and people we have just made a decision, taken over, and they're still sitting. So they are afraid to invest their time, money, and effort. Don't keep searching for new ideas. Another big problem is we get the good idea, we work on it for a few days, and now we leave that idea, we look onto something. This problems or which among these issues I think is your primary issue. I want all of you to be very open today and let me know among the points which I have stated. Let's say point 1, 2, 3, 4, 5. Which of the point resonates with you the most? If you have to give one point, which is probably the point which resonates with you the most, which among this point is what resonates with you the most? Just put up as 1, 2, 3, 4, 5. Any number which you feel very honestly, no one is going to criticize you. We are all here to grow together. I also had my flaws. You also have your flaws. Let us try and really, jerk ourselves up and try to figure out what best we can do in the upcoming days. So Dr. Aniket is saying number 2. Number 2 and 3. Okay. Dr. Meena madam, nice to see you. Yeah. Okay, great. Great. Amazing. Dr. Sheikh, number 2 and 3. Great. Okay. Amazing. So let's all decide if we have realized so far that the problem is us and these are the constraints which are holding us back, how to go about this journey. I mean, what exactly we should do to increase our practice. Now we have to accept the fact that our practice is totally revolving around patients, our source of income. Now, a lot of people, I don't know for what reason, they feel ashamed to talk about money. See, unless you talk about the subject, the topic, which is your requirement, you're not going to get inputs. So for example, I want to learn about the planetary system. Obviously, I have to go and speak to the people involved in that business. Now, right now, we are in the business of dentistry, if I may put it properly. We want to do good and ethical work for other patients, but at the same time, we want to earn from it. There's nothing to be ashamed from it. So we want to earn ethically, we want to work morally, we want to do the best for our patients. And that's how I suggest we start thinking about money. It's not that by charging the patient, you're doing something. It's your rightful money, it's your hard-earned money. The bigger question about generating revenue is how much we can generate. So all of us know that when we treat patients, we generate money. That's not the question we are answering right now. The question is how much more we can do when we are doing this process. Now, what are the 3 pillars of this process according to me? One is efficient marketing, easier treatment plans, and good return of investment. I think they will crack the code. So let us take up marketing. Now, a lot of people mistake marketing as giving out some scheme or offer. How many of you feel, let us be honest with each other, that marketing equal to 50% discount, 30% discount, 10% discount, free scaling, free polishing, that is what is market. How many of you feel so? Many of us. But that's not true. Now, put yourself in this situation. Let's say example, just think about this very practically. Listen to me very carefully. Let's say, God forbid, tomorrow you have a neck problem or a spine problem. Are you going to go and start searching out for who is the cheapest spine doctor, physiotherapist, or are you going to search for who is the best physiotherapist, who is giving you the best results? What are you going to search for, the best or the cheapest? Quickly, let's see. Let's not waste time. Just keep replying. I want the WhatsApp group to be continuously buzzing. Cheapest or best? What are you going to look? If I require an eye doctor, let's say ophthalmologist, I am going to look out for who is the best in my area. Probably even if I have to travel a bit for some complicated problem, I'm ready to travel. That's the way I'm looking at it. But I want to know how you are going to look at it. If you need a doctor for your mom, dad, some of your relative, are you going to look out for the best, or are you going to look out for the cheapest? Great. So everyone is going to look out for the best, which means that marketing not equal to discounts. If some people feel wrongly that by throwing a discount, people are going to queue outside their clinic, it's totally wrong. Do you agree to this statement? That by throwing a discount, you are actually devaluing yourself rather than actually promoting your clinic. The idea of marketing is not to throw an offer. The idea of marketing is to let the people know about your availability and what all techniques you are having, what all facilities you are having. Because unless you let people know, they will not come to know. So patients are not looking for cheap, they are looking for good. Our idea of marketing for so long has been totally wrong. And those patients who were looking for cheapest doctor are probably never your patients. Because for example, today, if I'm planning to do a scaling in 1,000 rupees, offer 500 rupees, tomorrow the same patient who is looking for cheap goes to another dentist who is doing at 400. And that story never ends. The patients who are looking out for cheap work are never your patients. The doctors who are offering cheaps and discounts are never your competitors. Do you agree on this point? Is it like a bulb on moment for all of you where you feel that yes, probably what I was thinking so far, that person giving this price and this was competitive for me, but that is actually not the case. Is it a bulb on moment for you? Just type bulb on if you agree to this. Is it something new and you have never thought about this like this in this direction? Now, the idea of marketing, as I told you, is to make yourself available with newer technology, with something new you can do, probably showcase some of your cases. That will create a curiosity. For example, if you get an ad today of getting a perfect physique in 20 days with no diet and exercising only for 20 minutes, how many of you will care to at least make an inquiry? I think almost all of us. You may or may not go, but the idea of marketing is to create curiosity, if you look at it, so that you can generate inquiry. The step number 2 is this inquiries now need to be filtered, not by you, by your efficient team member who can pull out the right candidates for you to enter into your practice. Having a trained member who filters this inquiry is as essential as you upgrading any other skill. How many of you feel that this is probably the missing link and you have never thought about it in this way? Have you missed it, or are you practicing it? Missed or practicing? That's good to know, Dr. Amol. Dr. Meena madam also agrees it's all rubbish to give discounts. Very true, madam. Dr. Amol practicing. Dr. Aniket has missed this. So I hope this is value adding to your evening today where you start thinking in these terms. Dr. Gaurav, so almost all of you are missed, and Dr. Ankur is doing himself, but now you realize, see, the moment you make yourself available at every call of the patient, in some way you are devaluing yourself. Please remember this. Nowhere you will find a top-notch doctor directly attending every and any queries. If you go to a good hotel also, let's say you go to a 3-star hotel, 5-star hotel, and if you ask for a transport, they will say my transport desk is there, please here. If you ask for food, they will direct you to their kitchen. So that's how they also work as a team. If you want to project yourself as a 3-star, 5-star dentist, as a top-notch dentist, you need to understand, you need to have an ecosystem where every people has a designated work. You cannot be doing all your work because what you need to be doing is coming up next. If you focus on all these small tasks, you're losing out the big picture, which is revenue generation. Mind you, answering a phone call not equal to revenue generation. Performing the operation is revenue generation. Your work is to perform the task in your clinic. The other work of giving an appointment, etc., belongs to someone else. Please realize this fact. By you getting onto the phone call, asking the patient to make payments, coordinating with the lab, you are wasting your precious time, which you could have learned, used to upgrade your skill, read a novel, do one of your hobbies, or probably do anything else which you would probably be could do to increase your revenue. How many of you feel that taking up unnecessary phone calls is wasting a lot of time in your practice? I want to know how many of you are taking almost all your calls yourself. Thank you, Dr. Sumit, for agreeing on this. Okay. So the key to doing good business next is understanding what. So when now you have created a good marketing situation, created a marketing plan, for which if everyone wants, we can have a separate lecture presentation later on. But let's assume that you have focused on the right things, projected it to the world, created the curiosity, generated the inquiries, and now you want to filter. How are you going to filter? How do you know this is the right kind of people for me? How would you know? A key to doing the good business is understanding why would the patient choose you? How would they know you are good for them? Is only if your thought process and what the patient is looking out for is syncing with each other. As long as there is a mismatch in what the customer wants and what you're providing, no matter you can spend millions of rupees on marketing, nothing is going to work for you. The moment you put up something where the customer is looking out for that kind of services, you will see it's a mind-boggling change. Automatically, the customers are calling you up to let you know more about the procedures or to know more about what you're doing. So it is not about what you're doing. It is about what you can do or how you can present yourself in probably the ways which other your competing doctors are not. Or I would not use the word competing, or probably they are not yet focused on. None of us are competing with each other. As we already discussed, our competition is on with ourselves. We want to improve on what we can do from today to tomorrow. That's the goal we want to get into your practice. So I want quickly all of you to let me know from their years of experience, patients are looking out for reasonable treatments, less time consuming, and they should, whatever treatment you do, it should last long. Are there any other points which you feel your patient is looking for? I want to read in the WhatsApp group. Please put up in the WhatsApp group if you have any other points beyond these 3 points. What are your patients seeking at? How can we understand what exactly the patient is seeking? Let us understand what our customer is looking at. Forget what you have read in the textbooks. Use your own head, use your years of practice to let know what your customer is looking out for. Or if you agree to any of these points, you can just put it again. Absolutely, it's fine. Painless and fast treatment, amazing. Dr. Sheikh, one more point, painless and fast. If any one of you wants to put up the same point again or any other point, Dr. Amol is agreeing to these 3 points. Reasonable treatment, painless. Yes, it's a good point. Painless is more a part of the procedure. How many of you feel that a complex textbook plan will more often than not get rejected? Which means if a patient, see, I'm not against any branch of dentistry. I'm a dentist myself. I have tremendous respect for all my colleagues. But the topic of today is not dentistry. The topic of today is revenue. Please understand this. Let's not create unnecessary drama around this. We are not discussing dentistry today. Our topic of today is the direction for generating revenue. As simple as that. Let's not complicate. So I'm not, when I say regarding root canal or when I say regarding composite fillings, I'm not against. I do it myself, or rather I was doing it myself also. It still happens in my clinic and it's an excellent service. That's not the question I'm asking right now. The question we are discussing today is revenue generation, and how many of you feel, let's be very bluntly honest with each other. If I have to do a class 4 filling, place a rubber dam on the, inject the patient, place a rubber dam on the patient, do the class line and those line markings, create a putty index, do the layering, do the finishing, polishing. According to you, this process of doing one single class 4, how much time will it take if I want to do this textbook type work? How much time would you need to do this work? So Dr. Sheikh is saying 1 hour. How much time would you need to probably do first expertise in microscopic root canals and then start removing a broken file microscopic, and more importantly, let's address this main point which has never got addressed so far. How much can you charge? I have a neighboring dentist who charges, let's say, 1,500 rupees for a composite filling. The patient calls him up, how much would you charge? I have broken a tooth, I want filling. He'll say 1,500. I am placing rubber dam, I am doing those line angles, I am doing nice restorating work, layering technique, 1 hour, finishing, polishing. I want to charge the patient, let's say 6,000. Let's be very honest with her. You think the patient is going to come down to my clinic? In most occasions, unfortunately, no. How many of you agree that this is one of the biggest barriers? Even though you want to do good work, 90% of our population, fortunately, unfortunately, still looks at what we can say as a base level treatment. They're not looking at high-end dentistry. At least in my practice, I may be wrong. This is what I'm saying openly. I'm in a public forum, and this, I want to know how many of you agree to this point. Do you agree that most of our patients are looking at simple level services? And even if I want to put my heart out and do a 1 hour job in composite filling, maybe I may charge 4 or maybe 5. If I'm a very big name for some reason, in that case, 6,000-7,000, not more than that, for a 1 hour job. And what happens, God forbid, when the filling breaks? What's your ROI? How many of us are forced to redo it because the patient expects it free? Unless we answer these questions bluntly, honestly, nothing is going to come out of this session. It is high time that one of us brings out all these points by discussing. It is not only about dentistry. It is our revenue associated with dentistry. It is about how we can grow along with our, if patients want their benefit, we are also screwing our back, we are screwing our neck, we are putting our hard-earned time, we are putting our infrastructure, we are investing our skills to do that job. I think the benefit should be at both the ends. How many of you agree that these are never the topics raised at some of the important forums? So how many of you agree that a complex textbook treatment plan will be rejected? If you feel rejected, you agree, you put up agree. If you feel you disagree, you put up disagree. Now let's compare another treatment plan, conventional versus basal implants. Now when we look at conventional implants, we require detailed blood reports, CBCT to plan invasive procedures like ridge plate, armamentarium for doing the ridge plate, skills to do the ridge plate. We need to attend courses to do how to know to do the ridge plate. Patient is rejecting our treatment plan, which means you discussed 1 hour everything with the patient and now he's rejected your treatment plan. I've heard of situations where the patient goes to the CBCT center, gets redirected to another center. So there's a chance of you losing your patients with when you refer. So patient has come for work and we are referring the patient back out. This is happening, my friends. Let us address all these problems practically. Complicated prosthetics. So you place the implants. Now the company people tell you for this you need to buy a gingival former lab analog. So let's say you're doing 4 full mouth cases, 6 and 6, 12 implants. So that means you put 12 into 4, 48 implants, 50 implants. You require 50 gingival formers, 50 lab analog, 50 impression post. Or if you're doing digital protocols, maybe you require 10 or 15 digital lab analogs and digital scan body. Don't you think all this is a burden on you for doing the good work for the patient? Are the patients going to pay you for the lab analog, gingival former, etc., because patients already want a discount on the implant treatment? How many of you feel that these are very valid points? As opposed to when we do basal implants, we are doing safely in people who have compromised medical situations. Rarely do we need CBCT. Simple single kits, no complicated armamentarium, and scalable, repeatable work. Every day with the single drill, simple osteotomy, simple treatment plan, simple prosthetic protocols. How many of you feel that what I'm saying is absolutely valid and it is directly connected to the return of investment, to the revenue you are making right now? How many of you agree? How many of you agree on this point? So we should be prudent on what we are marketing as well. So all those of you, with due respect, those of you who are marketing for free scaling, 50% discount on scaling, free dental checkup, what is the client you are attracting? Do you really want a scaling patient in your practice? Do you really feel the patient will be wowed by your scaling and he will refer you implant patient? Where is the logic going when you are asking for a 50% discount on scaling or maybe a free checkup? Do you really feel? And if you feel it has worked for you, why are you in this webinar? Why don't you just put up more coupons of free scaling everywhere? The fact is, my friend, it is not working for you. And it is time we accept that this is the problem and it requires a change of our mindset. And that is why the understanding the ROI, return of investment. So always opt to market the procedures to invite those kinds of clients where there is good ROI, return of investment. What we mean by good ROI? Where your armamentarium reduces, your efficiency increases, your predictability increases, whether it's a resolved job, whether it's a healthy job, you are doing single drill protocols, you are doing immediate load. And that's how even my front desk, with due respect, who are not as educated as us, can handle patient query because they are also able to understand what has to be done for the patient. It's so simple. But most of us feel that by complicating our life, we'll get more out of it. It's the reverse. It's so reverse. Just think about it this way. So let's categorize the patient to 4 categories for deeper understanding. Not affording, not willing, which means this group of patients, they are unfortunately not able to afford payments in the private practice and nor they are willing to do the treatment. So if you tell them come up for a toothache and if you tell them to make a bridge also on the other side, they are not willing. Second category, not affording but will push himself, which means they value their good health. Unfortunately, their financial condition doesn't permit, but they will push themselves. They will borrow the money. They will opt for the EMI option. They'll do something. They will to just do some good work, they will request you for a genuine discount, which is obviously fair to pass it on to them if they are really not affording. And third category, affording and not willing to spend, which means they have all the money, but they don't prioritize their dental health, though they have the money to spend for it. They feel they can probably spend on an expensive holiday, but they will not spend on a good dental treatment. And affording and willing to spend. If I have to put this as 1, 2, 3, 4, which category of patients would you like in your practice? 1, 2, 3, 4, quickly. If you have to categorize the patients, is there any other category I've missed out? You can put it up in the group. But according to me, all patients can be put up in one of these 4 groups. And the patients, then everyone I think agrees on 2 and 4, 2 and 4. See, 2 is a tricky situation. I mean, they really want the work. And if you can, just help them with the cost barriers, I think you will have some money going for you as well. And that is where if you have kept your armamentarium simple, your just simple, you will be able to even solve. And mind you, this group 2 is a very, very big number in India. If I consider an average Indian population 150 crores, 30 teeth, I think more than 40-50% of the people are in the second group. So you really cannot ignore the second group. You just have to bridge the gap. The best way of bridging the gap when the patient cannot afford expensive treatment is to make your cost of treatment affordable to them. So because they cannot rise to what you can provide, you can come down to what you're looking for. Does this ring a bell in your brain? Do you feel that the patient who could not afford a red split, complicated sinus lift, bone grafting, membrane, implants, second stage surgery, missing his duty hours multiple time, asking his boss to give him leave multiple time, coming to your practice, will probably agree if he has a 2 or 3 day Diwali break with single piece implants, crown and bridge work? Do you think your conversion will be easier, at least, if not difficult, with this group of patients? Does this ring a bell? Is it a bulb on moment for all of you? Are you realizing the points, the loopholes which you are missing out on? Have you ever thought about this point this way? It's not about conventional basal, it is about your practice. Mind you, there are speakers who speak about conventional basal, but the person who is in charge of your practice is you. It is you right now who will make the decision after this webinar what you want to. How many of you feel that there are bulb on moments with you? And then I want to bring on to you how you can actually propose a treatment plan. I use the word propose because there's a very fine line, some wrong choice of words, some notions between you and the patient, some miscommunication, and the patient switches the mind and he does not want to do the work with you. How many of you feel a lot of times you have just and suddenly the patient you cannot do the treatment you? How many of you have experienced this? How many of you want to know the exact template of how to propose a treatment plan to the patient? Just to put up, bring it on, BIO, bring it on in the comment box. And I will share you my time tested personalized template, which works in 11 out of 10 patients, if I may say. It always works because this patient treatment planning template is derived from the patients. We are coming, the way what I'm going to tell you comes from the patients to us rather than coming from us to the patient. So how many of you are excited for this? Just type BIO. So let's say we have patient Now let's forget everything else. Let's say the chief complaint of this patient is this missing front teeth. That's what his complaint is to us. How I would address the patient for the missing front teeth is, like most of us do, we tell him that we can extract this mobile teeth and we can create bridges in 5 to 7 days, and the approximate cost will be between 25 to 45,000. The side effect or the disadvantage of the bridge is that we'll have to shape up some of his healthy teeth, and the life of the bridge is equivalent to the life of the teeth which are shaped up, which in my opinion, in his situation, is 3 to 6 years. And there is another treatment, definitive treatment, where we can create new pillars to give him new teeth. So I'm talking to the patient, which will cost you approximately 1,000 to 1.5 lakhs, but it will sustain longer because the pillars are created, which are new pillars, they will sustain longer. So next question the patient asked is, why there is such a cost difference? Your answer to it should be, or the patient will ask you, so let's say you have heard this conversation, put yourself in this situation. According to you, what will be the next question by the patient? This is assuming we have categorized the patient into, out of those 4 categories, you have picked up the 2 right categories of patients. One is ready to pay, willing for treatment, and the second group of patient which you have picked up, willing for treatment but not affording. These are the 2 groups we are addressing to. Am I correct? If one of this patient, let's say both the situation, if category 2 patient is sitting, what will be his next comment according to you? Category 2 patient, this is the pitch I have given. What according to you will be his next question? So Dr. Sumanti of the fixed treatment, Dr. Mandar is saying, see, how to handle guarantee warranty, Dr. Sumit, I give a separate 1-hour lecture on it. So I would request, let's just keep that part right now, because these videos are also coming on the social media right now, and I want to be in the correct frame when I quote a lot of practical things. So let's keep it exclusively to the dental fraternity, if I may say. Some other time we can discuss it. So Dr. Mandar is saying, why is the cost of implant so high? So yeah, this is a very good question. So the next thing for cost of implant so high is again a very good question, but I will not go into the nitty-gritties of it because that is another separate lecture by itself. How to handle, this is called as how to handle cost rejection, which means when you want to make a high ticket sale, the patient will create barriers for you to create that high ticket sale. How to handle this is a separate topic by altogether, but in general, some of the answers we have already discussed in the previous inner circle, but these are interesting topics to discuss. Maybe you can remind me in some next inner circle class we should. Yes, so Dr. Ankur, this is the perfect point I wanted to discuss. I am having a bridge lasting 10 years, why not a bridge? Now the rule in your consultation is never you can start from no, which means, example I'm saying, if the patient says, doc, can you save this tooth? Your answer is yes, I can save it. Or let's forget this tooth. Let's say this is a grade 3 mobile tooth. And the patient says, can you save this tooth? You can never say no. Yes, I can save it. But unfortunately, the destruction is so much, it may not last more than 1 to 2 months. Remember this is a psychological phenomenon. When you start your answer with yes, you are on the same team. If you start your answer with no, already you're creating barriers between you and the patient. It is just the difference of words. They are more soothing. They are more connecting to the patients. So it's not that. So let's say there's a situation where someone is dying and you go to the doctor. Doctor, can you save him? He's going to put his efforts. He won't say no. Whether he will live or not live is the question of prognosis. So I have seen a lot of doctors starting the statement with no, which itself is a game killer. So try to practice this and let me know what change it makes in practice. Save it, but unfortunately, the destruction is so much, it will last for 1 month, 2 months, 3 months. And hence, I recommend you think about something more definitive. How do you find this as an answer? Much more soothing, much more collaborative with the patient. Why my bridge will not last for 10 years? Reason is my teeth. See, when I'm giving you the bridges. Your teeth are your own. This teeth, how much ever they will survive, my bridge is never going to break. It is the life of your teeth, which as per this X-ray is 3 to 4 years. So I assume that the bridge will be 3 to 4 years. Even I want to love it to last more than 10 years. That's how you should go about it. I hope this is making sense to you. Once the patient develops a rapport, you try in the conversation to get the budget from the patient. Now, let's say the patient says, okay, doctor, so your next question to the patient should be after one or two of answering his question is, what's your approximate budget you're looking at so that I can help you or I can guide you make a better decision. So the patient will say, I'm ready to, let's say, spend around 30,000, 40,000. If the patient tells you is ready to spend 40,000 rupees, do you think that you should take him in the direction of implants? Do you think just by knowing, that's how people sell, right? So when we go to a mobile shop, what is the first question the mobile owner will ask you? What is the first question he'll ask you? What budget are you looking at? That's how he can help you. That's how a salesman can help you make a decision. If you're looking for a flat and the broker comes to you, he'll ask you two questions. Which area are you looking at rental? What is the area and what's the approximate budget? That's how everyone is looking at it when it comes to sales. Unless you know the budget of the customer, you are really not going to crack the sale every time. But if I know, for example, this patient comes with a budget of 10,000, I can still show him the benefits of an RPD. I mean, simply giving him what he wants. But you know what mistake people do? They will speak to the patient for 1 hour. They will tell him everything about the implants, why implants is good for him. And then they will tell him the cost is 1.5 lakh. Patient is now convinced that implant is the best option for me, but I cannot afford this, doctor. So what does he do? Let me find a doctor who can do implants which I can afford. That's how all your hard work of 1 hour is taken away by someone else. Do you think that this is the exact mistake you are doing in your practice? Yes or no? Do you think that this simple one tip will help you convert more and more patients just by changing the kind of interaction you were having earlier with your patients? That is what I want to do for my fellow colleagues. From my years of experience, I want all of you to prosper, grow in your practice, not get blinded by unnecessary drama, which sometimes we get carried away with. Let us all focus on what really brings benefits to us as well as the patient. Now, the important thing, as we understand this, is when we want to grow, is invest in new technology. Manufacturing units, any entrepreneurs, if you look at software design, what they will always be telling is, I want to invest in the new age technology because technology will make your life easy. So always invest in technology and adaptive systems. Nowhere you will find any entrepreneur, any business provider, I want to complicate my office work so much that no one can understand it. But we are doing it happily. We want to do complicated CBCTs. We do respect. Be very honest to yourself. How many of you even know how to interpret the CBCT yourself without any help? But you want to do it. You want to have complicated armamentarium. You want to give patients complicated treatment plan. You want patients to get convinced with the complicated treatment plan. You want him to pay you for your complicated treatment plan. Do you think all this is utter foolishness on our side? Do you think that a simplistic system is the need of the hour? Do you think that practically forget everything else just from the rate ROI point of view, return of investment point of view? Don't you think that you need to cut down your unwanted inventory, lab analogs, gingival formers, screws, impression post, digital analogs, so forth and so on. So many things. Don't you think you want to just cut them out? Life would have been simple, like your crown and bridge work, you're making impressions, taking things ahead, sending it to the lab, fixing it. How many of you feel that to grow, things should be simpler, not complicated? How many of you feel that though you have understood all this, you are not taking the plunge to upgrade your skills? Because unless though you went through the entire webinar, you agree to every point, you reply to every point, and now you go back home and watch TV. What's the logic behind this? I don't understand. You could have might as well invested your time with your family and friends and not attended the webinar. So many of us know what is right, but we don't want to upgrade our skills. We just hold ourselves back for I don't understand. We know, and then we cribbing that life is not changing, things are the same. We are not action takers. How many of you feel that we are just holding, in spite of understanding, in spite of telling yes to everything, we are not reading ourselves, just holding it back, cribbing whole day long? I'm hoping none in this inner circle group, my friends. We know there are a lot of action takers. I appreciate the enthusiasm of our group. I've seen always the people are making extra efforts to attend inner circle, raising queries, interacting with each other almost every day. There are so many interactions in the inner, and that's the purpose of this community, that we all should grow together. We have just recently the group purchase of Rooney scanner, where people have benefited close to 70,000-80,000 rupees. Plus, they've got the EMI scheme, which normally the Rooney's people are very hesitant in giving. The OPG also we are planning as a community. So I like the vibe of this community is to go together. We are here to help support each other, keeping this in mind. For the action takers, only for the next 15 minutes, my friends, only for the next 15 minutes. And I want only the action takers to, otherwise you can just take a coffee break for the next 5 minutes. Only for the next 15 minutes, those of you who are ready to take the plunge, the action, because I see a lot of doctors who are doing basal implants, but there's good scope of improvement. There are so many prosthetic things which they want to know, but probably they cannot connect the dots. 2 textbooks, surgical and prosthetic, the entire HD video library, where every step, every procedure is given in detail, step by step. I can promise anyone who goes through the HD video library will not have one query in the mind, because everything is put up in video, step by step. I'm reading out loud, I'm explaining you things, and to support it, a complete online masterclass where entire theory is synchronized and put up very systematically for you. So the textbook, HD video library, online masterclass worth 25,000 for all those people only for today who have put in this 45 minutes to 1 hour with me. Strictly next 15 minutes, we are sharing the payment link. Dr. Chaitali, please share the payment link. Just put up, those of you are interested, you can straight away pay 16,000 on the payment link. Mind you, it is worth 25,000, but only for next 15 minutes, I've dropped the price to help you all. 16,000 rupees. Those of you who make the payments, just put the screenshot in the group and put up as paid. And definitely you will not regret making this decision. This is one Diwali gift you could give to yourself, and this can change the rest of your life. And I can vouch for this from the number of success stories we have today to share with you. One among them is Dr. Sarita. I just call Sarita madam, she's there. So luckily for me, I have been given the opportunity to operate on Dr. Sarita. She's a dentist. She has a very nice practice. I operated on her mom. And after I operated on her mom, was unfortunately rejected by many other big known dentists. We operated with basal immediate load implants, a gummy smile, complete gummy smile. And after she saw the results, she immediately said she wants to learn this technology. She's done many courses of conventional, but she chose to learn this technology. And I want to hear all of you to hear her success story, just a 2 or 3 minute with Dr. Sarita. Madam, just come here. Please just take this chair. So I want all of you to welcome Dr. Sarita, madam, please. Madam, please come here. So, madam, thank you for joining us.
Hello, everyone.
I want every one of you to thank Dr. Sarita for allowing us to speak about I want all of you to welcome Dr. Sarita, madam, and thank her for openly sharing, madam. So, without wasting mom's experience, because I can understand how painful it was for you. Being a dentist, she was not having teeth. So, quickly, if you can tell everyone.
Yeah, she was having a distal extension case since 30 years. So prior to even I joining BDS, she was not having her teeth, and by the time I had passed out itself, she had lost considerable bone. And 5 to 6 years back, I did conventional implant course. In that course also, we got to do only anterior implants, and we were not able to restore the posteriors, as she required very complicated procedures like bone grafting and all. So, which my mother was too interested in.
Then I came to know about basal implants. And I suggested that to my mom, and she was ready for it.
And I approached
Doctor Sir to
Dr. Sir
get it done, and I also
joined this course and took the
online master class
and
the 3-day course.
3-day course.
I have also even started doing basal implants in my own clinic. And response is really good, and my mom is enjoying having food since the last 3 months. She is very happy with the
Madam,
basal implants.
thank you, madam, for giving agony. In spite of her being a dentist, she was not able to help her own mom. Her case was rejected by several eminent implantologists. She has done the conventional implant course, but was not able to help the mom. And more importantly, now she is happy to not only help her mom but several other patients. Important question for today, madam. What is the revenue jump you got in your practice? What is the revenue jump you got in your practice? What is the confidence level you got in your practice when you say about implants to your
Revenue
patients?
jump is very high.
Drastic change.
Madam, if you don't mind sharing, just 2x, 3x, 10%, 20%.
It is very drastic. When an implant patient
It is very
accepts the patients that have started suggesting,
this is
but
the last 2 months.
case
But the
acceptance is more.
case acceptance is more, and
revenue was really
the revenue
grown like anything.
definitely
It's a
it has grown
drastic
like
jump.
anything.
It's a
drastic jump. It's a drastic jump.
Yeah, more than like 20
Yeah, more
when you get it.
20x more.
when you get a implant.
20x more. This is amazing. 20x is amazing. So,
Usual stuff.
Like
Right.
So implants like full mark case is a real jump. It's a drastic jump.
great. And
And with basal, the thing is,
Case
case acceptance increases because you
cut down
the treatment time and the complicated procedures.
of
Sinus like grafting, the healing time is greatly reduced.
so, since you have recently started, madam, what is one tip? Just one you want to people who are on the edge, they think whether to do basal, not to do basal. One simple tip for all of them.
The simple tip is it's very important to learn all the basics, whether it is basal or conventional. It is best to have all the things in your armamentarium and be ready to do it for your patient. And basal is a very good option that you can have in your armamentarium. It gives you an edge. It's not like you should not do, but whether conventional gets its limitation, there you have basics. So you don't feel limited or constricted.
Great. Thank you, madam, for joining us. Thank you today.
Thank you.
So I want all of you to type MPTY more power to you, madam. Thank you for openly sharing. Just type MPTY more power to you for Dr. Sarita for openly sharing her inputs. And 20x is a huge jump, madam. Congratulations. Even I was not expecting such a huge figure, but it's amazing to hear that by just incorporating. Now, which other dental procedure you think you can incorporate in your practice which can jump your revenue? I would not say 20x really. That figure, but you think can see. I'm not a proponent of basal implants. Let me tell you, I'm a clinician first. Tomorrow, if some new technology comes, which is more interesting, which is more resonates with the kind of work I want to do, I will jump onto it. But as of today, as far as dentistry is concerned, fillings, root canals, crown and bridge, I think it's a very no-brainer right now. And I want all of you to say MPTY in the WhatsApp group we created. So those of you who were saying voice echoing, unfortunately, the only part you missed out was madam saying that her practice has shot by 20 times and she has been able to help her mom and several other patients with basal implants, which unfortunately was not the case when she was trying to do the work with her mom's case. Was an extremely resolved job. And I think mommy is here.
Yes.
Mommy is also here. So if mommy comes in, I will make a quick video with mommy also. You can see the amazing results. She is able to eat after many years thanks to immediate load implants. So that's the fact. Okay. And let us all congratulate and say MPTY to Dr. Sarita madam, and thank you for openly sharing not only her views but her mom's view. And mom has given me permission. So I'm just going to quickly put up mom. Mommy ji, zara ek minute, please. Just take the phone closer to mom, and you can all see the wonderful. Mommy ji, smile कीजिए quickly. और आपका, क्योंकि आपको कितने डेंटिस्ट ने रिजेक्ट किया था, राइट? और आपका क्या अनुभव रहा सिर्फ एक 2 मिनट में, क्योंकि काफी सारे डॉक्टर है जो यहाँ पे डर रहे कि बेजल इम्प्लांट्स करना चाहिए, 2 मिनट से क्विकली आपका व्यू जो भी है.
मेरे को कोई तकलीफ नहीं हुआ, अच्छा से ट्रीटमेंट हो गया, अभी अच्छा बात सकते, मैं बहुत खुश.
अच्छा, ये सब छोड़ो, आपकी लड़की बेजल इम्प्लांट करना चाहिए या कन्वेंशनल इम्प्लांट करना चाहिए? ओके, ठीक है, फाइन.
दोनों तरह से पेशेंट आ रहे हैं.
गुड, राइट. Amazing. Thank you, madam. Thank you so much. So thank you once again for joining us. Thank you. So I hope all of you enjoyed this small live interaction which we had luckily today. And what have been your 3 key learnings so far? I just want all of you to let me know your 3 key learnings so far before I carry on with my presentation further. Yes, Dr. Ankur, we are addressing what you have just mentioned very soon. Meanwhile, just a few minutes left for the action takers for today. Already, I think we got 1 or 2 screenshots of the payment. But for others who have missed out, quickly I will read out 2 textbooks, surgical as well as prosthetic book, the complete HD video library, which gives each and every step in detail in the video, and the complete theory about the basal implants in the online masterclass worth 25,000 only for the next few minutes, now at 16,000 for all of you. So those of you who are having some difficulty in payment, 93215-33493, that's Trisa Enterprise, you can connect to them because someone has messaged me they're having difficulty in payment. So just I put up the number, you can connect with Trisa Enterprise and you can just see how you can work around this thing. Okay. So now after listening to this success story with basal implant, I want to make one big confession right now, is that my purpose right now again is not to tell you all regarding whether you should do basal implants, not do basal implants. That's not the purpose I am here with right now. My purpose here right now is to empower you all to make the right decision. So please don't feel that I'm trying to deviate you in any direction. I just presented whatever little bit I know from my 14 years of progressive experience in implantology, doing implants day in, day out, conventional as well as basal. Not many of you know that till 2012, I was also lecturing for 18 implants, teaching people how to do conventional implants, done all kind of conventional implant courses you can even think about, spend lakhs of rupees, invested in every equipment in conventional implants, only to abandon that procedure from 2014 onwards. I still do couple of conventional implants, but my right now, if you ask me, my heart and soul is in basal implants simply because of all the advantages which I've shared so far. So again, to repeat, my purpose is not to tell you what is good for you. That's you smart people can decide yourself. My purpose is to guide you, make the best decision for yourself. Think about the ROI, make the decision. And in case if you choose basal implants, I can promise that I will guide you to the maximum possible extent to master this technique. Now, there are a lot of myths and unnecessarily circulated. Some of this, which can you all type the myths which you have come across related to basal implants in our WhatsApp group? Some of them which I have come across is that there is no literature available. Mind you, literature is available from 1860 onwards. Next, the myth is that there is no follow-ups. I mean, that's again a big joke, because if you just scroll through my own Facebook, I will show you follow-ups up to 7 years. Even in the textbook, I put 4.5, 5 years follow-up. As of now, I have patients with more than 10 years follow-up. I've seen other presenters in some of our basal implant conferences presenting 20, 25 years follow-up. There have been more renowned personalities in basal implants. I have seen in their books follow-ups up to 12, 15 years as well. Retrievability is not available in basal implants. Again, this is said by people who don't know the implant system in and out, because with intraoral welding, we do absolutely wonderful retrievable solutions. Yesterday in the inner circle, I have put up the video on a retrievable screw retained basal implant prosthesis. I hope all of you have liked it. And another thing, people will scare you. It's very technique sensitive, pterygoid and all those things. Now, I just feel like laughing at them, because if they say it's technique sensitive, I don't understand. Then how can reed split and sinus lift not be technique sensitive? So, people trying to scare you off by saying it's a technique sensitive. Now bypass is technique sensitive. God bless them, because for them, doing a reed split, bone graft, taking a rib graft, all that is not technique sensitive. But doing a single trigal osteotomy is technique sensitive. Is there any other myth you people have heard of when it comes to basal implants? I just want to know out of curiosity. Do you think that a lot of things which have been circulated? Dr. Vishal Rathod, thank you. We've received your payment. Thank you for sharing the screenshot. Basal implants don't osseointegrate. Again, a myth. We have already had this discussion. I shared the articles on how any polished surface implant. In fact, the biggest irony of the fact is that the first evidence of osteointegration was on a smooth implant. So definitely, it's a myth. Thank you for sharing, Dr. Amol. Not evidence-based, again, is just an accusation. I don't think there is any power to this statement. Is there any other myths you have heard regarding and you feel that, we can just laugh about it today? Thank you, Dr. Meena Madam. I hope you are enjoying it so far. Thank you for trusting us. And now, who are these people who, according to me, are circulating, we should counter check also that the person who is putting up all this, is he an expert? Is he an expert? How many basal implants is done? And if he's not done basal implants, how many conventional implants is done in resorb jaws? What was his success rate of conversion? What I mean is that when the patient came to him, he proposed a complicated treatment plan, how patients got converted or they just ran away. What is success implant and what is their long-term follow-up? Because we are putting resorb implants in resorb jaws almost day in, day out. What is the success rate of this kind of treatment? So that is what you should be questioning. And probably, as per me, what could be the reason of bad mouthing by the so-called people against basal implants is, I personally feel they have the personal motives, simply because either they don't do it themselves or their practice is affected by people who do it, or they have company driven agendas where companies want you to invest in infrastructure, they want you to buy the complicated armamentarium by them, and there are lots and lot of speakers who fortunately unfortunately have tie-ups with the company and they are saying things which the company people are asking them to say. So these are all the take home points you should consider. And when it comes to basal implants, a lot of times there is also a dilemma which company to select. So my tips for this should be, you think about a company which is economical yet research driven. So for R-line implants, I have been into basal implants for almost 10-15 years now. Whatever inputs I had by working on various basal implants company, all those pros and cons have got filtered out and everything got incorporated into the R-line implant system. The company provides various options, which means with R-line, you can have a manual as well as digital protocol. You can have a screw retained implant protocol. You can have a cement retained implant protocol. You can have a two-piece implant. You can have a one-piece implant. And all of these implants, the biggest beauty is 2500. So that makes it really economical, really flexible. And of course, we are all there to give you good back-end support. The 15 minutes for this amazing offer are nearly getting over. So if anyone else is keen on it, please book it immediately. Mind you, please don't come back to us asking for this offer. This was a one-time offer for all of you. Dr. Mandar has put up occlusion is complex, retrievability. Obviously, we addressed all this, and Dr. Ankur, you have already seen the good aesthetic outcomes even in the resorb jaw in a lot of the cases. So all these are myths. And once again, I want to know all of you, from all of you who have attended so far, what were your 3 key learnings from today's webinar? I really want to know from all of you, what was the value add this webinar has made for you? What were your 3 key learnings? There's so many people online still, so good to see all of you hanging out till the end. And I throw open to a couple of questions from all of you. But before that, I want all of you to put up your 3 key learnings on the WhatsApp group. Please don't put up the 3 key learnings anywhere. I am checking the Facebook link. The Facebook link has been put up on the WhatsApp group. Just click on the Facebook link and put up your 3 key learnings over there. Dr. Sarita, madam, please request you to use the Facebook link to put up your 3 key learnings, as we set up right now to take a few questions from all of you. So just request all of you to use the Facebook link and put up your 3 key learnings. I'm looking forward to see your 3 key learnings for today. Dr. Ankur, just request, just check the link, please. It's working. So just, can you give me one mobile, please? So Dr. Ankur, just request you to put up your 3 key learnings of today. Dr. Sarita madam on the Facebook. I'm looking out for your 3 key learnings on the Facebook link. And meanwhile, I want to take up questions by you. and I'll try to handle it with the best of my abilities. So anyone who has any queries related to basal implants or today's webinar, you can put it up in the inner circle. So queries you put up on the inner circle, and your 3 key learnings you put up on the Facebook link. So Dr. Ankur has mentioned the concept of placing pterygoid implants got much. Choosing your patients, don't say no, train your assistant. So Dr. Sarita madam has put up the main takeaway point for her was filtering the inquiries. So just like the patients filter the doctor and choose the doctor, I think it is high time as a doctor you empower yourself what procedures you want to really focus on and what kind of patients you want to focus on. It's not a one-day game. Remember, you're going to be in this for the rest of your life. So you might as well. Mandar has put up adapt simple systems, cut down unnecessary inventory, decide the skill to upgrade and invest in upgrading. Thank you, Dr. Mandar. If possible, I once again request all of you to put up these 3 key learnings in the Facebook link. This is the Facebook link once again. So just put it up over there, please, so that these learnings can remain with us even after the webinar, and those of you who probably watch it later also can refer to this point. So I request once again to put up the key learnings on the Facebook link. And meanwhile, I am looking out for queries, if any, on the WhatsApp group. So those of you who are watching this on Facebook, I request once again to join our Inner Circle WhatsApp group to remain connected with us. So Dr. Joglekar Dental Implant Solutions has put up adapt simple solutions, cut down inventory and decide which skill to upgrade. Amazing. Dr. Mandar, is it possible for you to just come online if possible? So I see close to around 35 participants right now, in spite of being a holiday. Thank you for joining me.
Yes.
Yeah, Dr. Mandar, hi. Nice to hear from you, sir.
Yes. Thank you. I just taken the course
Sir,
as
just
well.
your takeaway points, and if you could add on to something else.
I'm really fascinated by the R implant system, and I really want to understand it first and then join it. So I have taken the course as well. That today's offer I have taken as well. Last week I bought the books, and today I have taken this offer as well. So I'm looking forward to
amazing, sir.
learning and adapting.
Great. I'm sure, sir. Just it's a matter of time. And from this open forum, if you pursue what Diwali, you will have different things to fire on.
So my main problem was earlier for 10 years I am just learning and reading about Basal, and I was really afraid to dive into it. And I'm doing conventional for last 10 years, but Basal I never thought of doing. And after seeing the retrievability, it has I have become more confident, and seeing your cases, your videos, I've gone through all the available videos on YouTube channel, and I'm going to learn now with today's offer. Thank you very much.
Thank you. Let's all type MPTY and welcome to the family, Dr. Mandar. Nice to have you along with us. And we'll soon be interacting with you again. So one of the questions Dr. Jolly has put up, people say basal life is less than conventional. See, the life cycle of any implant, if I can go into the details, is called as a cyclic fatigue, which means any titanium screw, it can have a particular number of stress cycle before it fatigues. And all of us know that in basal implants you over-engineer the case, which means you have 10 implants in the upper jaw, 8 in the lower jaw. I'm talking about a full mouth case. So if you have to make an apple-to-apple comparison, it's like a no-brainer that the life cycle to cyclic fatigue, and also remember the cyclic fatigue and the stresses are more when the implants are rigid in nature, but basal implants being isoelastic in nature, better adaptability inside, because bone is also a flexion, bone also has its own flexion, which we don't normally realize. So these are very small and minute level points which can be kept discussing, but on a practical note, in fact, the life cycle of a basal implant, if you look at it, is much more than any other rigid, conical, hollowed implant where the screw will keep having repeated problems after a few years. Dr. Rajashri, welcome. Thank you so much. Dr. Swapna Jaiswal has put up, understand the ROI, cut down inventory. Thank you. Learnings, amazing. Discount attracts not so good patients. Second, formulate the treatment plan. I'm so glad that you have jotted down all the key points, which will be helpful for others also to revise. If possible, I once again request all of you to put up your 3 key learnings on the Facebook link and not on this WhatsApp group. And Dr. Sheikh, thank you for sharing your views. Upgrade yourself. Smile surgeon is how to train the lab in basal implants. Excellent question. But as of now, one of the best things you can do is gift your lab person the prosthetic book, which includes the detailed lab procedures as well in detail for the digital as well as manual protocols. So I made sure all the lab procedures are put up in the prosthetic book. But if the lab person wants some kind of a hands-on training, then the best thing to do is send the lab person to our lab courses. We also conduct lab courses in Bombay, where you can really, so a lot of doctors come to our courses with the lab technicians, where the doctor is learning the clinical part and the lab person is learning the lab part. So that's how it's a good idea to also get your lab person along. Or if you both cannot come along, only the lab person can come, and we also conduct the lab courses. So if any one of you is interested, we will share the details. Just DM us on Trisa Enterprise. The prosthetic book right now is in printing, as I've already shared. So the prosthetic book, a lot of people are asking. It should be available in the next 30 to 40 days. So just bear with us because it's in the print and we have got record orders. Actually, I was also not expecting such a huge order. So some colleges and some overseas doctors have also ordered in bulk. So we need to print a larger quantity for all to get their copies. So just give us around a month's time, and I think I will try my level best to give it as soon as possible. For those of you who are specifically on the prosthetic book, please hold on for some more time. Meanwhile, the surgical book and HD video library and other things you can start going through. So Dr. Ankur is asking, is it necessary to remove third molars in segment implant cases? Absolutely not necessary. Those rules are given in the surgical textbook. Please request you to go through it. So every query, actually, if you just read the textbook 2 or 3 times, I think it should get solved. Regarding what is included in the course packages and all, I request all of you to connect with Trisa Enterprise, because there are some combination combo offers and all those things available. So 93215 33493 Trisa Enterprise. This is the number. You can share all this. My agenda right now is to share the medical part with you all. Regarding all this, I think it's best you connect with Trisa Enterprise. So I hope today's webinar was fruitful for all of you. Thank you for joining. Once again, have a great year ahead. And I look forward to knowing from you what should be our next topic. So whenever you have time, please put up in the inner circle group what can be our next topic of discussion. Till next time, thank you very much once again to all of you. Thank you. See you soon.